Lauren, maybe you are using a headphone or speaker or something.
Christine, could you please take over and just lead us through this session if you don't mind, while I sort out my sound issues. Christine or Yvonne? Participants, are you able to hear me now?
Still very faint.
You are sounding very far away, Laureen.
Maybe, do you have headphones? Maybe that would work.
James, please give me a minute to just sort that out.
Good afternoon, everyone. Can you hear me?
Yes, we can hear you.
We can hear
Better
you
than
5.5.
Laureen. Okay, my name is Yvonne. I just take fine. Thanks a lot. I just quickly take over. Welcome back from the panel session. I really hope you enjoyed them. You have learned something. And actually, in these last minutes before we break to the lunch break, we just wanted to learn from each other. What have you heard? What are the key lessons learned in that panel session? And maybe I hope that our facilitators and co-facilitators from the panel sessions are back to the plenary, so that I can just hand over maybe the word to Sarah Cornish Spencer. She was the facilitator in the first panel session. Sarah, can you unmute yourself? Hi, Sarah. Thank you for being there. Maybe you can just give us some few reflection from your session, which you just finished right now. Any key reflections, any highlights you can share with us? Thank you.
Yvonne, how many minutes, just to check, because I think we had 10, but I imagine it's less now.
We have this session up to 1 o'clock, 10 minutes after 1 o'clock. So you have some few minutes. Thank you.
Few minutes, okay. Thank you. So I just pasted in the chat to highlight who presented in our session. We were very grateful to Roland from CARE and Rosella and Sadera from UNICEF, as well as the WPE team, Fiona, Jane, Esther, Beatrice, Rocky and myself presented on EMAP. So we had 3 positive masculinity approaches presented, engaging and influencing men and boys across the community. And we had some really interesting questions raised. And unfortunately, because we had so many presentations, no time really to discuss. So sorry, I was just noticing the chat saying that people can't hear me, but I hope some people can, because I was just discussing with Yvonne. So some of the questions that were raised to kind of push us to explore more deeply, we're raising some of the challenges with male engagement work. So how do we mobilize men to participate in our positive masculinity engagement programs? I think we had some lessons learned that were shared across the 3 presentations. For example, there was a theme around engaging leaders. So often leaders in government, leaders in the community, leaders in religious institutions, that there was success found in mobilizing men across the community when we had already engaged these influencers in the same programming, and making sure that they are supporting and reinforcing our messages to men, was one of the successes that was a theme. There was also some questions about training the role models for care and the facilitators for UNICEF and IRC. And absolutely, that is an incredibly critical piece. One of the pieces of EMAP, for example, is a training that goes on for several weeks. And in all of these male engagement programs, that continued supervision and skill building of the facilitators, whether they are staff or community members, is so critical. And then in addition, in the EMAP approach, we have an accountability mechanism to women. Not only that you should have female supervisors so that men who are facilitating can practice their own accountability to a female supervisor and be ready to listen and adjust their and learning, continue their learning, but also that in the community, we need to be hearing back from women. And as we begin to build on what we've learned in our male engagement work across the different organizations, I think we're seeing that we need tailored approaches to reach all men and boys across the community. So these in-depth group discussions that we're having need to also be followed on with further community mobilization across the community. And if we'd had time to discuss, I would have mentioned raising voices, which the SAFA Together approach is something that IRC is very is engaged in being supported. I know lots of other people on this call are also in the relationship with Raising Voices, who is training us on SAFA Together, and we found that investment in the smaller groups of men and followed on by this wider community activism really helps to make sure that the people talking in the community, thank you, Janae, the people talking in the community who are speaking out against violence against women and girls, that are speaking for a new type of manhood where men are behaving in non-violent, power-sharing ways that are better for them and the whole community, but of course mostly for women and girls, that when men are able to then be supported into activism that is guided in the way that the SAFA Together approaches, you see that effect moving across the whole community. And it also guides men away from roles that can be harmful. So we've also seen men who feel very empowered from going through positive masculinities curriculums, then going out into the community and actively identifying women and girls as survivors of gender-based violence, or taking lots of space in the women's movement events. So we need to always be conscious of that accountability to women and girls, making sure that we're creating space for women and girls first, and as men and boys listening and following the lead of women and girls. We're excited to say that EMAP is being updated, and the new approach is going to engage adolescent boys, as well as bringing in our safe at home approach, more positive masculinities around fatherhood, which I think we all know is incredibly powerful for men to take on new roles at home. That's probably enough from me. Yvonne, shall I hand back to the next presentation? Thank you so much.
Thank you very much. Thank you very much, Sarah. I think that was really a very nice summary I've given us from the whole session one. And also a lot of learnings. It seems it was a very interesting session. Thank you very much for that. But let's move on, because we don't have a lot of time left before the lunch break, to the parallel session 2. There we had as a facilitator Billy Molosani. Maybe Billy, you can also give us just few insights from your session, some key learnings, or what you found interesting to listen to. Billy, over to you.
Thanks so much. So on behalf of the 40 plus and the 50 less participants, I would like to thank Azinza and Rita for sharing key learning. In our group, basically, a number of issues came up. One is there are 4 key areas of working with men and boys. And that's one, we need to provide some motivations of working with them. And in our presentation, what came out very critical are issues of addressing issues of the livelihood needs, issues around in the Indashakrai, there was issues of the economic benefits, so men participating in VSLAs, but also appreciating the work that they do. Another key area that came out is the whole issue of capacity strengthening, capacity strengthening of the individuals as well as the communities. In the Shakra, they shared that they had a 21 session participatory kind of capacity strengthening, but also Dr. Azinza shared both an individual as well as a community level kind of capacity strengthening in psychosocial support. Another key area that came out across the two presentations is the issue of ensuring that our work is changing the relationships at different levels, and the relationships basically addressing issues of partnerships. Partnerships between males and males, partnerships between males and females. In the Shakrai, they shared a concept where men were found in women's spaces. And Dr. Azinza shared issues around partnering with local agencies and local institutions that are in the community. And lastly, another key area that we should focus as we're working with men and boys is the issue of the structures, and the structures here being basically the formal and informal policies, laws, regulations, including the social norms. In the Dr. Azinza shared their work around referencing the legal and policy frameworks, and the Indashakrai basically looked at the issues of addressing the social norms. So these are the key 4 areas that came out throughout our discussion. And in terms of the key learning from the participants, just two. One is the issue that came up is the issue of resistance. And the key learning is resistance is normal, and we can use it as an entry point for reflection as well as for programming. Another key reflection that came from the participants is that we need to explore engaging men without necessarily promoting the women's agenda. And one thing that came out was basically around working on the wounds of life and how questions around wounds can inspire men to participate in advancing the women's agenda without necessarily being explicit about the women's agenda. Those are basically the key learnings that came, and thanks to Azinza and Rita for sharing their knowledge as well as experiences around engaging men and boys. Over.
Thank you, Billy. That was also very interesting what you said, and I even can hear some similarities to session 1, especially about capacity strengthening, that we should not always focus just on the individuals, but also on the community, local community around these individuals. So thanks for that, sharing about session 2. Now, maybe for the last 5 minutes, I would like to hand it over to Sunita from the UN Women. You have facilitated session 3. Are you around? Can you also give us some feedbacks, please? Sunita, over to you.
Thank you. And actually for session 3, the co-facilitator, Francesca, is going to actually give the feedback.
Oh, okay. Thank you for clarification. Thank you. So please, Francesca, you have the floor.
Great. Wonderful. Thank you. Yes, so like all the other sessions, we had some great presentations. Sadly, not as much time for discussion afterwards, but I know that everyone's going to have access to the presentations, and the conversations will continue throughout the day. So in our session, we had 2 presentations, and there was a link between the 2 on how faith interacts with culture, understandings of gender and of violence. So Wezo from TIFAN was presenting on the Transforming Masculinities approach, which is working with faith leaders and faith communities to promote gender equality and positive masculinities, and talking through how that engages the whole community, from faith leaders down to community dialogues with men and women, and so really trying to be inclusive and collaborative. And I think that's one of the things that really came through from both presentations, was the importance of contextualization and collaboration. So within the talk about transform masculinities, we talk about making reference to scriptures and looking for positive values within scriptures that were well known and that were important and valuable in people's lives, in order to promote gender equality, and that being a process with faith leaders and faith communities. And then we had a presentation from Dr. Amina and Dr. Zinawak on the Dil project, in Ethiopia, which as a whole project is very collaborative, looking at having a very decolonial approach to research and practice. And they're also talking about working with faith, looking at how faith, men were expressing that faith could be a deterrent, wanting to be morally righteous was a deterrent from acting, perpetrating violence. And so again, looking at how faith interacts with how people understand gender and violence, and particularly in the Dildo project, we were hearing about a really innovative research methodology, which was using pictures that have been designed by the community, representing different examples of gender-based violence, and asking men to reflect on these images, to put themselves in the picture, to see how they would respond, whether they saw it as justified, how they would act differently. And the presenter was really unpacking how this was really helpful, both for making an accessible research tool that doesn't require literacy. It was also much more engaging and emotive. Researchers were able to read body language in response to this approach, and also began already a process of reflection from the men as they looked at these different examples of gender-based violence and reflecting on their own behavior in the past, analyzing, having perhaps previously thought this was common in their context, having a moment to reflect and think, would they want to change this behavior going forward? So it was really powerful in terms of seeing how this research tool opened the way already to intervention and change. So I think that was really exciting to hear about, and we had some questions about ethics and how to use these tools, and I think Dr. Reeman is going to share more about that. But yeah, I'd say that really a takeaway for me anyway, and I'm sorry I didn't have a chance to check this with the whole group, was really around this contextualization and collaboration process to make sure it's meaningful for the whole community in order to promote gender equality and gender-based violence. Thank you.
Thank you, Francesca, for that summary of session 3 and even your personal view. So at this moment now, I really would like to thank all of you, the whole audience, that you kept us company throughout all our technical problems. Thanks a lot for all the facilitators and co-facilitators of the parallel sessions to help us to maintain a good spirit in the parallel sessions. For now, I can just say we will have a break now, a lunch break. It's now actually 1 o'clock East African time, Nairobi time. So we will back at 2 o'clock in the plenary session. Please use again the main link you have in your program or agenda. And I hope that somebody, yes, I can see it from the UNHCR, the technical team, they already have put the link back to the main session, to the plenary session at 2 o'clock into the chat. So please use that link again to join us at 2 o'clock. Thanks to everyone. I'm really happy that so many of you joined us for the whole morning, and then please just reconnect at 2 o'clock, 2 p.m. Nairobi time with that link you see in the chat. Thanks a lot.
Can you hear me now? Good afternoon, everybody. Welcome back. I hope you had a great lunch break, and we are coming back to our afternoon session. For those who have just joined us and you were not there in the morning, on behalf of the Regional GBV Working Group for Eastern Southern Africa, allow me to welcome you to a symposium on the gender transformative approaches to engaging men and boys in GBV prevention and response in humanitarian settings. For the benefit of those who were not there in the morning, we had a couple of sessions and very exciting discussions, some of them in plenary, some of them in parallel sessions. And we are hoping to build up those discussions in the afternoon and we are asking you to please keep up with the lively engagement that we had experienced with you in the morning. Feel free to ask your questions and provide your questions in the chat box. We may not be able to respond to all of them, but we will definitely take them into consideration when we compile our meeting outputs and when we record this meeting. So allow me to now move into the subject matter of the afternoon session. And in this sense, so we are starting off our afternoon with a presentation. We will have a presentation from Hannah. Just give me a minute. Yes, we will have a presentation from Hannah J. Hannah J was a consultant who has worked who worked with the GBV AoR extensively in coming up with the GBV AoR Guidance Note. Anna's presentation will be on addressing the needs of male survivors, the GBV AoR Guidance Note, addressing the needs of male survivors of sexual violence in GBV coordination. Anna, I hand over the floor to you, and you have 25 minutes for your session. Please go ahead. Thank you.
Thanks so much, Laureen. Can I just check that you can see my slides okay?
Yes, you can. Thank you.
Okay, wonderful. Well, thank you again for inviting me to speak on the GBV AoR Guidance Note on addressing the needs of male survivors of sexual violence in GBV coordination. It is somewhat of a mouthful, but the guidance note itself was developed as a result of direct feedback and requests that the AoR were receiving from coordinators in the field for further support and guidance around how to support male survivors. And so therefore, this guidance note is very specifically directed to GBV coordinators under the AoR and has a really strong focus on the core functions of coordination. In saying that, however, I know we have a broader audience here today. There is also a summary of evidence around the needs of male survivors of sexual violence, as well as some further information on disclosure and help-seeking behaviour, and information around service types and service needs from male survivors that would be of relevance to a broader audience as well. So the guidance note itself was developed after a fairly long consultative process, and this involved, of course, an initial review of published evidence, but then a real deep dive with interviews and focus group discussions with coordinators themselves to understand their needs, and also practitioners in terms of what they were seeing in the field and the challenges that they were encountering, the AoR and its members itself, and of course.
Sorry to interrupt you.
Yes,
but
no.
your slide has something at the top that is preventing us from seeing the full slide.
Sorry.
Your slides. There is a box on the top on your screen that is preventing us from seeing your full slide. Something around customize the videos. Okay, just go ahead. It's probably on my end. Just go ahead.
Oh shit. Okay. I think
Yeah, it's on your end.
I think WebEx puts that up. Sorry, Laureen.
That's correct. Sorry to interrupt you.
No worries at all. And the consultation also involved discussions with the protection cluster, child protection, AoR, and other partners in terms of, such as health partners, in terms of their support for male survivors, because we know that there is a need for multi-sectoral support. And of course, I'll go into that a bit further as I go through. So the guidance note itself is not prescriptive on minimum actions, and it's really designed to provide some direction and some information on key actions and options for coordinators to integrate into their work. And I think important to note, particularly given the the core focus of this symposium, the guidance note, is intended to ensure that the work to support male survivors of sexual violence doesn't negatively impact the services and specific needs of women and girls. So I mentioned previously that the note has information around disclosures and help-seeking behaviours for male survivors, and we know there are numerous barriers to disclosure of sexual violence, and some of those for male survivors are similar in overlap to those of women and girls, and others are driven, I guess, by cultural expectations of masculinity, misbeliefs around sexual violence only occurring against women and girls, and some of the other intersectional aspects. I should at this point also say that, in all settings, consideration really must be made to the diversity of vulnerabilities, needs, protective factors, support, and the experiences of male survivors, and that different individual characteristics, experiences of intersectionality and oppression, and in particular age, experience of disability, and diverse members of diverse SOGS communities will experience sexual violence in different ways, and it will impact the way they seek and are provided support as well. And I know you will have sessions that delve into that a bit deeper, but I just wanted to mention that here up front. So the guidance note itself also sought to provide some key practical examples, and one of these was just to highlight the potential points of disclosure for male survivors, and to highlight the differences between boy survivors and adult male survivors. So this list is by no means comprehensive of all the services and places where male survivors may seek help, but it is a starting point to understand disclosure. And it's drawn from both published research on this topic, but also from the really practical examples and information that we were getting from the practitioners in the field. And as I mentioned, the guidance note focuses really specifically on those core functions of coordination, but it does so with starting to understand the risk factors and safety considerations for supporting male survivors. And again, this list is not exhaustive, but a starting point of those specific factors for male survivors. So the criminalization of same-sex relations, and we know this is a significant barrier for access to justice, and as well as the legal provisions around what is considered rape, what is considered sexual violence. And some of that legislation we know is gendered as well. And separate from that point, so this is, I guess, the criminalization of same-sex relations, and separate from that, the discrimination and violence against persons of diverse SOGS. So this may impact the way in which these individuals seek support, and particularly in instances where there is the appetite for tailored support services. This may pose a risk of secondary violence and persecution, and we know that. And I guess under this banner as well, just to be clear that there is, in this work on supporting male survivors of sexual violence, we keep in mind the need to preserve female-only spaces and services. And the guidance note also highlights specifically that male safe spaces as an intervention for male survivors of sexual violence are not recommended. And we know that perpetrators of sexual violence against men and boys are overwhelmingly male, and that replication of a gender segregated safe space model, such as a women and girls safe space, will just not work in the same way. So a male-only safe space would not provide the same safe environment for prevention of violence or allow for safe disclosures. And the guidance note goes into the key differences between male support groups, male peer support groups, male-only psychosocial support for survivors, and the distinction between those service models and those services indeed to the idea of a male safe space, but just as a side note there. So particularly in service mapping and referral pathways, this was a key area that came out in consultations that is a significant and ongoing challenge. So some key informants highlighted that referral pathways were just not effectively addressing or including the needs of male survivors of sexual violence in some contexts, and that was considering, I guess, the holistic picture of referral pathways. So not only GBV specific referral pathways, but other referral pathways that may exist for other actors. And it was felt that male survivors of sexual violence were in some instances falling through the gaps. So the recommendation is for strong collaboration where there are these multiple referral pathways for different sectors, and that for GBV specific referral pathways, either the inclusion of specific protocols for referrals of male survivors to a service that has appropriate entry points for men and boys, and of course that requires a mapping before the referral pathway to understand where men and boys disclose and where may it be safe for men and boys to be referred to, and this includes where there aren't, and we know this is often the case, where there are no dedicated or specialized services for male survivors, that there may be other services that still are appropriate and accessible, such as clinical management of rape and sexual assault services that are in health centers and hospitals, and other non-GBV specialized actors that are providing services such as general MHPSS services that are geared towards recovery from torture and trauma, or other services for reintegration around forced recruitment. So I guess the other key message is the strengthening of that cross-sectoral coordination in terms of referral pathways with non-GBV actors. I guess alongside that, is for GBV actors who may be working in settings where they would receive disclosures from male survivors, understanding how to make those safe and effective referrals. And I guess that aligns with this point in terms of integrating information around that's specific to your context and around where male survivors of sexual violence can seek support, where those services are being delivered, whether that's by partners of the GBV subcluster or by other actors, and to include information around limitations on services as well. Ensure where there are existing protocols and procedures that include specific information on male survivors. Ensure these are updated as well as obviously implemented. And yes, again, including those information around partnerships, and an obvious one obviously is with child protection for boy survivors of sexual violence. The guidance note as well goes further in terms of understanding the key considerations for GBV service delivery and providing some guidance to coordinators specifically in their role in the core functions of coordination, and also in their overview and that bird's eye view or holistic view of service delivery. So there was a lot of contention actually in terms of workforce considerations for male survivors in the development of this guidance note, and really where it fell was that male survivors will have varied and individual preferences in terms of the gender of the person that they disclose to and where they seek support. It was very clear, particularly from practitioners and from coordinators, that men and boy survivors may not identify as a survivor of sexual violence or as a survivor of GBV, and that also heavily impacted their preferences around service delivery and not wanting to go to a service that was labeled as a GBV service, and in many instances not wanting to disclose or to label their experience as sexual violence, but rather to seek support for maybe co-occurring violence or other experiences that they had. An obvious one, but ensuring that clinical management of rape and sexual assault services are accessible and meet the needs of male survivors. So some of the feedback that was coming was that in some instances, you know, how to deal with situations where the CMR services are within the maternity ward of the hospital, for example, how to do that effective training. So to ensure that if male survivors are not disclosing or identifying as a survivor of sexual violence, they can still get that clinical support that they need. And obviously that in-depth service delivery work goes a step beyond maybe this guidance note, but it does touch on some core concepts. A key one that came up is that it is very contextual as to where male survivors will feel that they can safely and routinely access support, and that the location of those services really needs to be determined in consultation with the community. Obviously, that's a sensitive thing to be discussing with the community, and that has to be done in the right way. But it was a key finding, I guess, because you know, we often talk about male survivors accessing support at the health centre or at the hospital, but there were other examples and other instances coming up of where men and boys prefer to routinely access support for ongoing support, and just to recognise that that may vary. Again, I mentioned briefly before, but access to justice is particularly complicated in contexts where same-sex relations are criminalized, and that criminalization is maintained even when it is an act of sexual violence. The legal definition of rape and sexual violence in many countries is gendered, and therefore a man can simply not be a victim in the legal definition of sexual violence. And the other area, which is quite complex, is for sexual violence that has occurred within armed forces, and that military justice systems sometimes are the court and the system for which that matter would be heard, which is obviously complicated. An interesting point that came up, and I think worth mentioning, was helplines, and in particular, many practitioners feeding back that they were seeing this as an area that may be an increasing way in which men and boys may disclose their experience of sexual violence. This was kind of a mid-COVID talk, so it was, I guess, progressing as further telephone counselling services and further helplines were being developed in response, also to COVID, and to some services being shut or being limited. And the training and sensitization of helpline operators around receiving calls from male survivors was an area perhaps for service delivery. Public information and communications also was raised in terms of not only having, you know, if it's relevant to your context, I think is the first thing to say, but not only having information that is inclusive of male survivors, but thinking about where that information and communications is targeted. So in spaces where men will see the information, in spaces where they may have some capacity to take in the information and see, you know, if there is service information or support information or helpline information, that they're able to access that and make use of it. That's all for my presentation. I wanted to keep it quite brief, so we had some time for questions. I believe I should also say that the guidance note is on the GBV AoR website, and I'm not sure if it has been shared otherwise. I think we have others from the AoR on the call too, so they may also want to speak, particularly to if there's any relevant questions for them. I see one hand up, Laureen. Did you want me to just take hands up, or did you?
Sure. If you can select a couple of people who you feel, if you would like to take a couple of questions because we have some time. I see a hand as well. Tiram Sartis. Not sure. I'm just going to make them a presenter so that they can ask their question and hear what they have to say. Please, if you have any questions for ease of communication, do type your question in the chat message. And as Anna has told us, the GBV, this guidance note is available on the GBV AoR website. And we are urging all of you to use it as a reference point or as a reference material. And we are happy to take any feedback from the guidance note as well. And if you have any questions at the moment, we will answer those. I am checking to see if there's. Yes, someone is asking. Christine has confirmed the guidance note will be in the resource folder that will be shared with all the participants after the event. Is there any other question? I think it's easier, participants, if you type your questions in the chat box. Then it's easier for us to just direct that to Anna. In the interest of numbers. Or what would you prefer?
No, that sounds good. That sounds fine. Thank you, Laureen.
Okay. And say a question in French in the chat box. No, I think it's an administrative question. It's not related to the matter, to the subject matter at hand. Anna, I think we're good. We should let you go. Clearly, you gave a very comprehensive presentation because no one is asking any questions. If you have any questions, please just put them in the chat message. And then
Sorry, Laureen. I think there's one question.
Yes.
From
Joy.
Yes, so I see a question from Joy asking, is there anything in the directive for service centres to help victims not to become perpetrators? Joy, there's not at the moment. I certainly take that as a great question. I think obviously that work is quite specialized for psychologists, and I think there is a body of work on that in terms of when I wrote the guidance note. There is a body of work on that that's directed more towards psychologists and counselors. This guidance note is really more focused, I guess, on coordination and then top-level service delivery, recognizing, I guess, that's an important area, but I think perhaps something which would require greater detail than what could be included in this guidance note. Thank you, though, for the question. Sorry, I'm not keeping up completely with the questions.
Thank you. I'm told there is a question. Christine, could you just read out the question for us from Barbara?
So
I'm looking through. I'm told there is a question.
I have a question from Barbara. Have coordinators started using the guidance note, and has there been any feedback on the, I guess, on the implementation? So that might be something that Jennifer or Astrid want to speak to. I don't know. I think I saw Jennifer online or Astrid. Maybe they've dropped off.
If they are not available, we will still ask them to respond to the question in the chat as the conversation ensues. Barbara, we have taken note of your question, and we will get somebody to respond to you on that. I see we are just at the end of the session, the time allotted to your session. Thank you very much, Anna, for your presentation. In the interest of time, allow me to move on, members. But please, I'm asking again, if you have other questions, put them in the chat message and we will respond to them. We will take note of them and we will respond to them. Thank you very much, Anna. And I hope you stay with us for the rest of the session. We're not just leaving yet.
Yeah, thank you so much for having me.
All right. Participants, thank you very much. And allow me to move us forward to our next session. And so we had that plenary session with Anna, and we are moving on to our second session of the day, which is an hour session in the afternoon, and it is parallel sessions again. So if you for those of you who are here in the morning, you remember the drill of how we did the parallel sessions. But for the benefit of those who have just joined, allow me to say this. So I'm going to ask the IT team to we have 3 parallel sessions, and you can join whichever parallel session you prefer. So I will ask the IT team if they can share the links to the parallel sessions in the chat box. However, for those of you who received your programs, you can click on the links on your programs and they will take you to the parallel session that you wish to join. When you join a parallel session, we will ask that you exit from this plenary session, because if you do not exit from this plenary session, then we have a problem with coordination and we have echoes in the group discussions. So I will explain again. Our next session is parallel sessions. And in the parallel sessions, there is a link provided for each parallel sessions. We encourage all of you to join a parallel session of your choice. And to do that, you will be, if you check your programs, those who have a program, you will click on the link in your program for the parallel session that you want to join. I will also ask our IT coordination team to share the links for each session in the chat message for those who do not have the program with them. Our 3 parallel sessions will be, in each of the parallel sessions, we will have 2 presentations from different members. And in each session, there will be facilitators and co-facilitators. The facilitators and co-facilitators will manage each parallel session. And after an hour, we will come back to plenary. We will convene at plenary and get feedback from the facilitators and the co-facilitators. So I'm urging you now to please join the parallel sessions. If you have any questions on this, on how to do this, please share in the chat box. Someone asked if the presentations so far are being shared, that have been made will be shared. Yes, all the presentations that have been made today will be shared to you as part of the meeting afterwards. So if we could start joining the sessions, please. I have been asked to mention the sessions in the parallel set, the presentations in the parallel sessions. I think that's what you meant to say, so that you can know which one to choose. Okay, I will go through those very briefly in the interest of time for those who are still here. In the first In the first presentation, in the first session, we will have two presentations. One will be from Burundi, where they will be talking about challenges in providing care for male survivors of sexual violence. And we will have a presentation from Uganda on conflict and sexual violence against men, perspectives from South Sudanese men living in resettlement communities in Uganda. In the second session, we will get a presentation from Teofan on a healing journey out of the shadow into the light. Then the second presentation in the second session is about going against the grain, experiences of male survivors, male GBV survivors in Zimbabwe. The third session will also have two presentations, where one of them will be looking at understanding intersectionality in GBV, meeting the needs of male survivors of sexual violence, and this will be by IRC. Then ES Kenya will be looking at intersecting experiences of LGBTIQ and refugees in Nairobi. LGBTIQ refugees in Nairobi. And this session will also have a podcast on the aspects of intersectionality in humanitarian settings. So there are three sessions. The links are in the chat box. And you can choose which link you want to go to. Perhaps the IT support team can also share the program, the link to the program virtually, if you haven't shared that yet, so that those who do not have access to the program can get a link to the program and they can look at the sessions in more detail. Please, 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 we are asking, do join the different sessions, because I'm sure the conversations are starting there. The facilitators and the co-facilitators will be starting the conversations. Participants, please, I see a good number of us still in the plenary session. Kindly join the different parallel sessions. And when you join the parallel session, you have to exit from this plenary session. To exit from this plenary session, you just click the red button at the bottom of your screen with an X, the red button with an X, and you exit this session. Please join the different parallel sessions. The links are in the chat box. When you join the parallel session, please exit the plenary meeting. Please note that this session is going to be ended to reduce echoes and technical difficulties that is caused by having this session open and the parallel sessions open simultaneously. So we are urging you, please do join one of the parallel sessions, because this session is going to be ended soon. Again, the links to the parallel sessions are in the chat box. Feel free to click on whichever parallel session you're interested in, or you can click on the session that you're interested in on the program that we sent to you, and you can join the parallel session. Once you join the parallel session, you have to exit this plenary session. Thank you. Participants, we are urging you to please join sessions. We have 3 sessions. And for you to join the parallel sessions, you can check the links on your programs that we sent you, and you click on the link for the session that you would like to participate in. For those who do not have programs, if you check in the chat box, we have shared the links to the 3 different parallel sessions. If you check them, you will see that we have a link, and you can check the chat. There is a link, and you can click on it, and it will take you to the session where you need to sign in to the parallel session. When you get into the parallel session, we are asking that you exit this plenary session. Furthermore, we are going to end this plenary session in a few minutes so that we can avoid echoes and other communication issues that are arising from having this session going on while the parallel sessions are ongoing. Please note that you can only be in one session at a time. So please go into a parallel session and exit the plenary. Thank you. If you are having problems accessing the plenaries, the parallel sessions, please state in the chat box where the problem is, and we will help you sort out the issue that you are having problems with. Please be a little bit more specific. If the problem is you can't see the links, tell us you can't see the links. If it's the links are not opening, tell us the links are not opening. Thank you. Participants, we are urging you to please join the parallel sessions. There are 3 ongoing parallel sessions. Our technical team has put the links to the parallel sessions in the chat message, in the chat box, and you can find the link to each respective session. Please join the link click on the link to the session that you want to participate in. Once you join that session, we are requesting that you kindly exit from this plenary session. That is to avoid echoes and other communication challenges from you being in more than one session at a time. We are about to close this plenary session. So we are asking all of you to please move to the parallel sessions. Our IT person will close this plenary session. So we are asking all of you to please move to the parallel sessions. For those of you who have your programs, if you click on the link in the program, it will take you to whichever session you have clicked on that you want to participate in. Just go through your program. For this session, whichever parallel, there are 3 sessions that you choose from, and the program has a link for each session, and you can also join the sessions through that. You can use the links in the chat box, or you can use the links in the program. We are about to close this session. Please join the parallel sessions. Thank you. We will be back in plenary at 3:30 p.m. Nairobi time, which is about 40 minutes from now. We are about to close this session. Please join the parallel sessions. Thank you.